The facial nerve is one of the most anatomically complex of all the cranial nerves because it transmits 4 different types of innervation, and its branches take varied courses through the skull. Let's begin by looking at the 4 components or types of innervation transmitted by the facial nerve. The first component is special visceral efferent, or SVE, innervation to the muscles derived from the second pharyngeal arch. This includes all of the muscles of facial expression, plus 3 others: stapedius, stylohyoid, and the posterior belly of the digastric muscle. These are regular, striated muscles just as you find in the limbs and trunk. Their designation as special visceral efferent simply reflects their origin from the pharyngeal arches rather than from myotomes. The second component of the facial nerve is general visceral efferent, or GVE innervation, to 2 pairs of parasympathetic motor ganglia in the head, the submandibular ganglia and the pterygopalatine ganglia. The third component is special visceral afferent, or SVA, taste sensation from the anterior 2/3 of the tongue. Finally, the fourth component of the facial nerve is a small amount of general somatic afferent, or GSA, innervation to a patch of skin over the mastoid process and auricle. This innervation is not clinically relevant and is often excluded in descriptions of the facial nerve. We will include it here only for the sake of completeness. Now let's look at the origin of the facial nerve and the routes that these 4 types of innervation take to reach their targets. The cell bodies of the SVE neurons are located in the brain stem, in the motor nucleus of the facial nerve. The cell bodies of the GVE neurons are also located in the brain stem, within the superior salivatory nucleus. Finally, the cell bodies of the GSA and SVA neurons are located in the geniculate ganglion, which is positioned deep within the petrous part of the temporal bone. These sensory neurons send their proximal process to the solitary nucleus in the brainstem. All of these different components of the facial nerve come together at the brainstem, and together they enter the skull at the internal acoustic meatus. Even at its origin, the facial nerve proper is anatomically subdivided. The GVE, SVA, and GSA components are grouped together as the nervus intermedius. The large SVE component remains physically distinct from the nervus intermedius. After passing through the internal acoustic meatus, all components of the facial nerve travel in a bony tunnel within the petrous part of the temporal bone, called the facial canal. The facial nerve travels a short distance anterolaterally in the facial canal before making a sharp posterior bend, or genu. This bend marks the location of the geniculate ganglion. As we mentioned, the geniculate ganglion is the home of the cell bodies of the sensory neurons that contribute to the facial nerve. Facial nerve axons conveying motor innervation travel through the geniculate ganglion as fibers of passage. That is, they pass through the ganglion without making synapses. Distal to the geniculate ganglion is where the facial nerve components begin to diverge. First, the tiny GSA component of cranial nerve 7 leaves to supply a bit of skin near the ear. Again, there is no clinical relevance to this innervation, and its exact course is not important. One half of the GVE innervation leaves to form the greater petrosal nerve, which exits the temporal bone by passing through the greater petrosal foramen. The greater petrosal nerve then drops inferiorly into foramen lacerum to join with the deep petrosal nerve, which consists of postganglionic sympathetic fibers ascending on the internal carotid artery. Together, the greater and deep petrosal nerves form the Vidian nerve. The Vidian nerve then enters the Vidian canal at the base of the medial pterygoid plate and continues anteriorly until it reaches the pterygopalatine ganglion within the pterygopalatine fossa. Here, preganglionic parasympathetic axons synapse onto postganglionic parasympathetic neurons. These in turn distribute to the lacrimal gland and submucosal glands of the oral and nasal cavities. The second half of the GVE innervation and the SVA taste sensation combine to form the Chorda tympani nerve. Chorda tympani exits the skull by passing inferiorly through the petrotympanic fissure to enter the infratemporal fossa. Here, chorda tympani joins with the lingual branch of cranial nerve 5, and together these nerves travel anteriorly deep to the mandible. Along the way, the GVE fibers diverge to terminate in the submandibular ganglion. From here, postganglionic neurons distribute to the submandibular and sublingual salivary glands. In contrast, the SVA taste component of chorda tympani remains with the lingual nerve until it reaches the tongue, where it distributes to the taste receptors on the anterior 2/3 of the tongue. Finally, the large SVE component of the facial nerve gives a branch directly to the stapedius muscle within the temporal bone, then exits the skull via the stylomastoid foramen. It supplies the stylohyoid and posterior digastric muscles, then pierces the parotid gland to distribute to the muscles of facial expression. Note that the facial nerve does not provide innervation to the parotid gland, but merely passes through it. Cranial nerve 9 provides innervation to the parotid gland.